Hi, Pavan, how are you?
Hi, Harps. I'm good, thanks. How are you?
I'm good. How are the boys?
They're good. They're asleep, thankfully. So, hectic day.
Yeah.
Time to put them to bed. So, got some downtime now to chat.
Yeah. Good. I'm
How are the
glad.
boys?
Yeah, they're still awake. I mean, this lockdown has just thrown every schedule out the bloody window, but it's fine. I mean, they're chilling downstairs. They're watching a movie, I think. So yeah, they're all good. We had a bit of a chilled out day today because I had lots of work to do, so I just let them do what they wanted, really, which is a bit dangerous. But yeah.
You got to let them do it sometimes.
I know. How have you been? How are things?
I've been good. Maybe good's not the right word. I haven't been so great, in all honesty. It's been really stressful. Managing work and being at home in itself is a massive task.
Yeah.
But then with this whole COVID-19 situation, the pandemic, and how it's affecting our working pattern and what's going on in the hospital, it's massive. I had an email today and I found out that I'm likely to be redeployed to another department. Okay. So that's quite scary. It's not ideal. I'm worried about being around lots of COVID patients and then coming home to the boys and passing it on to them. So the other option is to live away from home whilst I'm working. But then I would also need to live away from home for 2 weeks after. And how do you do that with a 4 and 5-year-old? It's just...
It's tough. I know every time I see your posts and every time I see that you're with the boys, I almost feel like a sigh of relief, like that you're together. And I can only imagine how stressful it is, and like trying to merge those two worlds together, working, doing the job that you're doing, dealing with distressed patients as well. I'm guessing with mothers that are really worried, and coming home, and then obviously being worried as well about catching anything, and then coming home and just being a normal family. So I can imagine that's probably being quite mentally draining. How are you feeling about potentially being redeployed? Are you okay with it? Do you guys get a say, or is it just...
I wouldn't say I'm okay with it. I mean, I understand what the situation is. I understand why it's necessary. You know, when you become a doctor, you do it because you care for your patients and you want to do the best by them. But at no point do you think that by doing the best by them, you're going to be putting yourself and your own family at risk. And that's what I'm really struggling with. I'm struggling with accepting that that's something that I'm potentially going to have to do, or that I am doing, actually.
Is it for definite?
Well, there's some emails sort of flying back and forth. I've obviously addressed what my concerns are, and you know, I want to go to work and I want to help and I want to be there, but I have to do it in the right way for my own family as well, because that is really important. Then they don't come second to me, they come first. They come before anything in this world. I would drop anything for them, just the same as any other mother, father, parent, you know.
And you're only human. Like, this is a massive kind of thing, so keep us posted on that anyway. I'm sure you will. How is this whole COVID-19 thing affecting your role specifically, and also your department? What is the sense of, like, what is the atmosphere like at work at the moment?
I think everyone's just really trying to keep each other's spirits high. Public have been just so generous and kind. We're getting lots of chocolates and things in, just keeping us like going and motivated. But there's that underlying fear that's just running through all of us. So I was supposed to be on annual leave for the whole of last week. But obviously we didn't go away on holiday, so I was around, and I picked up some extra shifts because they'd asked us. Our rota's basically been thrown out the window, and now we're all just doing basically on-call shifts, 12.5-hour shifts, basically. So there's night shifts that needed to be covered because our more junior colleagues have already been redeployed. So we're sort of picking up that workload. Now, for example, every night we would normally have one consultant, one registrar, and two SHOs, which are the more junior doctors, house officers. But now we're having 2 consultants and 2 registrars covering. So there's been lots of changes, and obviously more changes to come. And just the difference between being at work on Monday and Tuesday night to being there just Saturday and Sunday night just gone. Our whole unit has just been transformed. You don't even recognise the place. We've got a big sort of barrier up halfway between the labour ward. So from this week, they're implementing like a hot area for COVID patients or suspected COVID patients on one half of the ward. And the other half is our cold area, which is for our non-COVID patients. We've also got 2-day assessment units as well. So we've got our, again, hot and cold areas. So we're really trying hard to do the best by our patients and to keep everyone safe and everyone protected, and protect staff as well. So that my unit's doing really well with it, actually. I'm really proud to work there, and their efforts are just, they're second to none.
So COVID pregnancy, say you have got coronavirus or suspected coronavirus and you're pregnant, this is one of my questions. Would you be treated in the main hospital, or would you be still in the maternity? Well, say you'd still be in maternity, just very separate to the routine people that are pregnant, women that are pregnant.
Yeah, so it really depends on what you come in with and what your symptoms are when you come in.
Yeah.
So, for example, if you came in with reduced movements and then we started questioning you and we found out that you had sort of COVID symptoms, we would do our routine checks and things. If we needed to keep you in because of an obstetric concern, then we would keep you in on the obstetric side. And generally speaking, we are trying to keep all of our patients on the obstetric side because it's much nicer for them to be around other, where there's midwives who know how to care for them, who know how to monitor baby, who know the right questions to ask and how to provide the right support. So that's what we're basically doing. But for patients who are deteriorating, obviously they may need to be transferred to other areas, such as sort of high dependency wards or intensive care. So it just depends really
on an individual case. So Nisha's just asked, which trust are you? Is this the same across hospitals, or does it vary by hospital?
So I won't share which hospital I work at because I just try not to do that on social media. I think it's just safer not to do that. But it might vary from hospital to hospital, but I think that most units are probably doing something similar or in the process of doing something similar. Even our theatres, we've got like a hot theatre and we've got cold theatre. So suspected COVID or confirmed COVID they'll be cared for in one particular theatre and the other patients in another theatre because, there's all things to do with ventilation systems and then giving time to clean that theatre, etc. So that's why we've got a separate theatre for those cases.
Okay. And how will antenatal and postnatal care be affected by all of these changes? So I know in our local hospital, I don't know if it's the same across all trusts, but I know our local hospital, you're no longer allowed to bring your partner to routine appointments or to scans, and you're only allowed a birthing partner right towards when you're in established labour. And I think they're only allowed to stay for 2 hours afterwards or something like that. How is that the same kind of everywhere now?
Yeah, I think we're all doing the same thing. It's really to protect everyone. I mean, the fewer people we have in the hospital, the better. People who need to be there do need to come into hospital. Having a birth partner present is really important. We completely appreciate that, and we don't want to separate mums and dads, and it's not an ideal situation, but none of this is an ideal situation, so we make the best of the situation that we're in and this pandemic that we're in at the moment. So antenatal appointments, we are just asking women to come alone, and same for, labour assessments. Only when you're in established labour are we saying that your birth partner can come. But it has to be someone who's asymptomatic, so who doesn't have any symptoms of COVID, obviously, to be able to be present. So it's worth thinking about different scenarios that you may find yourself in. Hopefully you won't. No one wants anyone to be in that situation, but there is a chance that you could find yourself in that situation where you're in labour and your partner or your birth partner has got symptoms of COVID or does have COVID, and I would start thinking about it now. Who would you have with you instead? Just keep that in mind. Yeah, definitely.
Okay, somebody's just asked a question about, I've heard that midwives are no longer doing house visits postnatally. How will stitches, etc. be checked?
So, from the guidance that I read, there should be at least 3 postnatal checks by the midwife. So that's on day 1, day 5 and day 10. They may not all be face-to-face appointments. And also, not all stitches need to be checked. So if you're concerned, you'll be given advice, even if it's a telephone consultation. You'll be asked a series of questions, and if there's any concerns, then they may suggest that you go and see your GP to get it checked. They may come out to see you in your home to check it. Or they may recommend that you go into the day assessment unit to get these things checked. But there will be an element of face-to-face contact postnatally, because postnatal care is essential care. It's what keeps mums and babies safe. It's how we pick up postnatal depression. It's how we pick up in babies, which needs following up. And there's some patients who will fall into the higher risk category, so they will definitely need face-to-face visits. So women who have had forceps deliveries or ventouse deliveries, so assisted deliveries, or premature babies or babies with low birth weights, or women with a background of mental health conditions. So there are higher risk women who will definitely need face-to-face review.
Yeah, and I think even if appointments are done on the phone, for example, the ones where they're checking, they're doing the assessment for your mental health and if you're okay, just urging people to be very honest. Just be honest with the midwife, even on the phone, or the health visitor, to make sure that you are, you get access to the right level of care. If you need that support for your mental health, because that was how I was first detected. It was by doing that questionnaire. And to be honest, whether she was physically here or not, even if it was done on the phone, the same thing could have been done. I could have still been diagnosed over the phone. So,
and do you think that you were quite honest in your responses? Was there any reluctance to be, I'll just say what I think they want me to say?
Yeah, I think for every mum, the biggest fear is that your baby's going to get taken from you, that, social services are going to get involved, or they're going to think that you're struggling, that you can't look after your baby. So that was always at the back of my mind. But our health visitor was so kind, and she made me feel really, really comfortable that I was very in tune and aware of how I was feeling. And I was really honest. I didn't feel, I was a little bit reluctant just because of what I've just mentioned, but I knew that actually I can't be the only woman that's ever felt like this before. And, she reassured me the only time they would ever do that is if you were unable to look after your child, which, most of the time, depending on your situation, I was still able to look after Arjun and I had the right support around me. But I was just struggling within myself. And it was because of that I managed to get the right level of support. How are they managing the shortage of staff in maternity wards given redeployment? That's quite good.
So we're all just stepping up, to be honest. We're all just picking up extra shifts. I'm part-time, but I've worked lots of extra shifts. They've also cancelled annual leave across the whole hospital in my unit, and I can imagine that's probably happening in other units as well. So that's how we're handling. And the consultants are sort of, all the elective things that don't need to happen necessarily, so non-urgent things are being cancelled. But there's more hands on deck for where we're needed.
Okay. Another question, slightly confused by guidelines. If you're under 25 weeks, are you classed as vulnerable, or do you just need to practice social distancing?
So, so the issue that we have is we know that from, is it 25 or 28 weeks? I feel like it might be 28 weeks. So the guideline says women above 28 weeks gestation are recommended to be particularly attentive to social distancing and minimising contact with others. So it's mainly for your third trimester, but don't be complacent. We don't know enough about how this virus is affecting women in their first and second trimesters. We don't think it's causing any problems. Sorry, my throat.
But yeah, it's just better to be safe than sorry, isn't it?
Just be careful. Yeah. I don't think it causes any problems with regards to miscarriage or problems with baby's development, but we just don't know enough about it yet. So
quite new. Can it be passed on? So if a mother gets the virus, can it be passed on to the baby? Do we know that yet?
So initially we thought that it couldn't be passed on, but now we think that it probably is passed on from mother to baby, but we don't know what the significance of that in the baby is. There's been lots of testing, and there was a case, I think it was in China, of the baby having passed on from the mother to the baby. So we think that it can probably be passed on.
Okay. That's even more of a reason to be safe, isn't it? Okay. So with regards to attending appointments, what can mothers expect? So I know for me, I don't know, especially for first-time mothers, I think it can probably be quite daunting. Is there any extra kind of, what can mums expect from their appointments? And I had loads of mums message me today saying they're really nervous. That there's so many aspects to why they're feeling like this. First of all, you feel it's daunting. It's a new process. You know, you're pregnant. You're growing a human inside you. Second of all, just in case any complications arise during the appointment. Thirdly, the guilt that they feel that the dad or their partner is missing out on, you know, these appointments. What is being done differently? What can mums expect, and what is your advice to them?
Okay, so I would say they're much quieter antenatal clinics. They're much smaller in numbers. So if you're having to come to the hospital, for example, we are doing mainly telephone consultations where we can. But there will be women that do need to come into hospital, and they shouldn't cancel appointments unless they're in self-isolation. And even then, you have to seek advice from your midwife. So, you know, some appointments just can't be missed. They are, you know, really important appointments. Yeah. For example, if you've got preeclampsia or any complications in your pregnancy, these are things that we need to be monitoring and following up. So, if you are in that situation and you think that you've developed symptoms of COVID, then you do need to call your midwife and you need to let her know. They will liaise with the hospital, or you can call the hospital direct and let them know. And it may be that if the appointment's essential, that you're still called in, but precautions and are made for you to come in safely, so that you're not, you know, in contact with other pregnant women. Yeah. Yes, it's really upsetting that dads are potentially missing out, and also it is very daunting that you're coming in alone to appointments, but we're there to support you as much as we possibly can. The team in the hospital are going to provide the best care that they possibly can, and if there are any complications, ask your partner to wait in the car so that if they do need to be called in, they can come in quickly. Okay, this is what my question was, that if there was a complication, would they be allowed to come in? And this is the same question that I had for after delivery as well. Say, you know, the mum needs to stay in with the baby for more than a night. Yeah. Would dads be allowed to come and visit, or not at all? No. Wow. We're being really, really strict about this. We're just being incredibly strict about it, for the reason of protecting everyone and protecting staff and other patients. So we're saying no, but the midwives are there to support support you. We've got healthcare assistants, midwifery care, support workers who can also help with breastfeeding and things like that as well. So if you're concerned, because I know that someone was asking about breastfeeding and they're worried about missing their appointment, I think that particular person has an appointment coming up before that breastfeeding appointment.
Yeah.
Definitely mention your concerns then at that appointment. And when you deliver, there will be people there who can support you with breastfeeding still as well after delivery.
I'll be honest, I mean, we weren't in this situation when we had Arjun, obviously, but I remember I think it was only the first night Breatham stayed, and then after that I had to stay in for a couple of nights. I just said, just go home and sleep, rest. And the midwives were absolutely amazing. They literally would come in, and I was doing mixed feeding. They would feed Arjun for me. They were literally there. They were nice to have a chat with. I understand that, I guess, at the moment, there's probably going to be a lot of pressure on everybody that's at work because of the staff, being redeployed. But they are literally angels from above. So they'll be there as well to support. And there's a question about antenatal classes and whether our trust offering virtual antenatal classes to replace the face-to-face ones.
I can't answer that question. I genuinely don't know the answer. I would hope so. Or I would hope that they're at least sending some resources out for women to go to get more information. I'm sure there are things in place and things are being done. I just don't know what myself right now.
Okay. Do you wear PPE at the moment on a day-to-day basis?
Yeah, so we do now. So for any patient contact where we're going to be closer than 2 meters, we are wearing PPE. I always apologise to patients because I know that it doesn't look very nice, does it? You're having this sort of normal birth experience, then someone comes dressed in an apron, got a mask over their face, got a hat on, got eye protection on, and gloves on. It's not ideal, but yeah, we are wearing that. So please don't be alarmed if you see us wearing it, because we're just doing that for all patients now, because even patients who don't have symptoms, they could still be carriers of the virus. So we're just trying to protect everyone by being extra cautious.
Yeah. If all goes well with the birth, how soon after birth can mums and babies go home? I know people that have gone home on the same day, if they've given birth in the morning, isn't it? If all is okay.
Yeah, so first-time mums usually do stay in for 1 day at least, because just to make sure baby's feeding well, and just to check everything really. But if you've had babies before, then after 6 hours or so you could be discharged home. There just needs to be time to do all the paperwork, and I don't know how baby checks are working now. I would think that they're probably trying to do the baby checks whilst you're in hospital, so that you don't have to then come back into hospital or have to go out to you. So obviously we need to allow time for that as well.
That makes sense. If there was, this is a personal question from me. So say I had the experience I had with Sargent, and he was unexpectedly born with Down syndrome, and I was in a pretty bad state that night, as was Breatham. What would it still just be, I'd kind of have to just get through it? That he was in ICU, he was in NICU for 5 days. I don't know how I would have, and I wasn't really allowed to go home in between. I'm not sure why, but I don't even know if you can answer the question, but what would happen in that situation?
I think, sort of unique circumstances would need to be assessed on a case-by-case basis. It would be hard to make a comment as to what we would be doing in each scenario. It would just depend, as I say, on lots of different factors. Obviously, we want you to feel supported as our patients. We want you to have all the support that you need, and where we can facilitate it, we obviously will. Yeah. But we are also trying to strictly stick to the rules, just to keep everyone safe.
And the number one priority is keeping everyone safe, isn't it, at the moment? So I think a lot of mums that messaged me were touching upon the sort of mental health I felt like there was a lot of anxiety and panic, and they're just really worried about how things are going to go, especially first-time pregnant mums. And what sort of support and access is available?
So I would say that your first port of call is usually your midwife. If you're feeling particularly anxious or you're not coping, then I would speak to your midwife. There are specialist midwives out there as well who can provide additional support if needed. You can always speak to your GP as well if you can't get in touch with your midwife. Again, they can provide numbers for things like talking therapies. You can also self-refer. So I know that I was actually speaking to someone. I went to Sainsbury's this morning for the NHS half an hour, and I was speaking to someone who works in Uxbridge. There's a talking therapy service there, and you can actually self-refer. So those things are out there as well. But I would say speak to your midwife or speak to your GP, and they will get things going for you.
Okay, and is that same with things like raising the alarm bells for things like domestic violence? Are they there to also sort of
definitely
situation?
Your midwife, definitely. There's also lots of online resources as well. So I know Women's Aid have a list of different resources for people who are suffering with domestic violence. Don't suffer in silence. This is not the time to be, suffering in silence. We need you to feel safe and to be safe and to know that there are people out there that can help. And also, because we ourselves recognise that this is potentially something that is going to become more common with social distancing and self-isolating at home. We will also be asking at every antenatal and postnatal contact about how you're feeling, lots of questions about your mental health and also about domestic violence. So if you are suffering, then speak up.
Okay, that's really helpful. It's probably a safer space to do it in as well now if your partner's not attending. Silver lining. Do you see a time where the baby's dad won't be allowed to be there during the birth? Do you see that happening, or?
So if they've got symptoms of COVID, essentially, then we would say that you can't be there, unfortunately, and then it would, as I said before, have someone as a backup in case they need to be there.
But you don't see a time where they put a blanket ban on
all birth partners, like no birth partners allowed at all.
Yeah.
I mean, at least one birth partner during labour and delivery of baby. So we are all really trying our best in all units to adhere to that because we know how important it is. I know that there were some units in London that weren't allowing any birth partners because the situation there just got so dire. There was just so much COVID around, and just from a safety perspective, they had to just say no birth partners at all. But since then, this guidance has come out, so I think that a lot of places will really be trying hard to stick to that guidance.
Okay. How long do you stay in hospital after a C-section if you're a first-time mum? Does it probably depend on...
It depends on how the cesarean section went. It was an uncomplicated cesarean section, and you're recovering well, and baby's feeding well, and there's no concerns with the baby, then you could potentially go home the next day or well. If not, then obviously it would depend. But we would say usually stay in hospital for 1 to 2 days. I think now we are trying to get people home as soon as possible, so hopefully after day 1
you'll be able to go home. Okay, so I had a series of questions, some of which have been answered during the talk anyway, but I'm just going to fire some questions at you if that's okay, Pavan. Yeah. Somebody's also just asked, do you think that when this is all over, will service return to normal, or do you think this will change practice for the future?
That's a good question, isn't it? I would think in maternity we will probably go back to how it was. I mean, it's my prediction. I mean, who knows what's actually going to happen? And I'm no expert. So, but you know, all the antenatal, postnatal care that's out there, everything that we provide to our women has taken years and years to develop. It's not just come out of the air. We didn't just pluck out of the air, okay, we need 10 antenatal visits. We know that this is what saves women's lives. This is what saves babies' lives. This is what prevents harm and keeps people safe.
Yeah.
So I would think that we would be heading back to where we were, and maybe changing things in ways to improve things. But I don't think, you know, anything will change for the worse. I think it will just be better, if anything.
Okay, so the first question is, we're due our first at the start of July, and it's a very scary and uneasy time. I'm really nervous and anxious about going in for my blood test and the gestational diabetes test, because you've got to sit and wait for 2 hours in between the two blood tests. I have to wait around there myself in case anything happens during the fasting test. What can I do? So what happens during that time? I guess mums are scared that they're going to get exposed to COVID, or, you know, just waiting around for 2 hours. Kind of, is that a standard thing? You've got to stay in the hospital. You can't go and sit in the car and wait. You've got to sit there and...
Yeah, I believe so. I have to be honest, I didn't do that when I had my glucose tolerance test, but maybe things have changed. Or maybe I just didn't listen to what they said carefully enough. So, but I think it's safe to be in hospital because you've been fasting. You know, you could feel dizzy, faint, you could pass out. You'd be in the right place if you were in hospital. So I would say, yes, you do need to stay in hospital. I would think that they have reduced numbers of women coming in for these tests at any given time, and we are also implementing social distancing measures in the hospital. So, you know, you won't be in a waiting area with 20 other people as you normally are, cramped into a waiting area. You know, we are implementing that at least 2 meter rule in the hospital setting as well. So yeah, I think that you are going to have to wait on your own, unfortunately. Take books, take magazines.
Something to entertain.
Listen to some music, use it as some downtime to reflect on things. Maybe start thinking about your birth plan. You know, just use that as quality time with your baby because you're just there on your own and it's just you and your baby. So flip it into a if you can.
How are you guys managing that? Because I know when I was pregnant with the boys and I'd walk in for my appointments and it would just be rammed. Sometimes there were no seats to even sit on. I mean, I obviously know that now the numbers will be reduced by half because most people will be going alone. But how, like from a physical space perspective, how are they? Is it by switching some of the appointments to over the phone and online?
Exactly, yeah. So there's too many appointments that are actually telephone consultations. I think the last time I did an antenatal clinic when all this was quite new, I think I had maybe 8 or 9 patients on my list, and I think I maybe had 2 patients actually come in.
Wow.
And even women in my unit who were having scans, if their scans are normal, they're actually being sent home from the scan department, and then the notes go over to us, and then we call them to discuss things with them, and they'll have their blood pressure taken and their urine checked before they leave as well. So.
Okay, it sounds like all the thorough checks are being done. With regards to one of the questions I had was, you know, measuring the bump at routine midwife appointments. Obviously, if you're doing these appointments over the phone, how are things like that being monitored to ensure that baby is growing as it should be and things like that?
Yeah, so the telephone consultations are, I think they're mainly for your hospital appointments. They need to be face to face. During the period of your pregnancy, you should have at least now 6 face-to-face consultations, and that's what was recommended in the most recent guidelines. So what they've said is, so I'll just go through your booking appointment might be a virtual appointment, but you will have a dating scan and that will be face-to-face, and you might have the virtual booking and the dating scan in the same place so that you can have both of those together. Then you'll have your 18 to 20 week appointment along with a scan, and that's to check for any abnormalities, any structural abnormalities with baby. So we do a thorough check at that appointment at your scan, and so we'll follow that up with a consultation. At 28 weeks, you'll come in, you'll have your bumps measured, blood pressure, urine checked, you'll have your 28-week bloods taken, and if you're rhesus negative, then you'll have your anti-D at that appointment. And then at 32 weeks, you have another appointment where you have all of the above minus the bloods and the anti-D. And then again at 36 weeks, 40 weeks. And then if you go post dates, what they're saying is at 41 weeks, you should have an appointment and an induction booked on that day. Either in an inpatient or outpatient setting, so that you're minimising your number of sort of contacts in and out of hospital or with midwives.
Okay, so it seems like there is a structure in place and they're spaced out and all the relevant checks. And I guess if anybody does have any concerns, and is triage still available?
Yeah, absolutely. So those are the appointments where we're measuring your bump and we're doing all the routine checks. But outside of those checks, you do need to be monitoring yourself the same as you would do at any other time. So if you feel that your movements are reduced, you must call maternity triage for advice. Don't hold off calling. I can't stress this enough. This is your pregnancy. This is precious to you. And don't delay. Seek the advice when you need the advice. Don't be worried. Don't be scared. Just pick up the phone and speak to your maternity triage. Same goes for things like any vaginal bleeding in pregnancy. If you get vaginal bleeding in pregnancy, don't just pass it off as, oh, it was only a little bit of something. You need to at least call up and potentially to get it checked. If your waters break, again, you need to call to let us know, and we'll give you advice over the phone, and maybe call you in. And symptoms of preeclampsia as well. So everything that you're told at your appointments that you should be looking out for, you should still be looking out for, and you should seek advice if you need to.
Okay. That's really useful, actually, because I know if I was pregnant, I'd probably be thinking, oh, I better not call because they're probably really busy and I don't want to kind of, stress them out. But it's true. It's absolutely important that this is still your baby. This is still a pregnancy. This is still a life. And, that's what the maternity triage is there for that advice. And there's no harm in calling. And they're always really lovely as well.
Yeah. Really important to stress that point, actually, because we're talking mainly about pregnancy and later stages of pregnancy, but we're getting a little bit concerned in the hospital at the moment because we're seeing fewer emergency cases come in for things like even in gynaecology. So, suspected ectopic pregnancies, miscarriages. If you have bleeding in your pregnancy, then you do need to call your GP for advice, and you may need a scan, so don't hold off coming in. I think we're seeing this across the hospital. We're all getting a little bit worried, like, where are our patients? These emergencies. Yeah,
like, are they okay, kind of thing.
Exactly.
Yeah, because ectopic can be really, really dangerous, can't it, if it's kind of left.
Don't take that risk on yourself. Let us deal with that. So you call who you would normally call for advice, and let us give you the advice of what you need to do next.
Yeah. Okay, emergency C-sections, how is it being planned for in terms of doctors or operating space being available? So I'm guessing, are planned sections being, well, I guess it depends on the reason why you're having a C-section, isn't it?
Yeah.
But emergency sections, how is the operating space being managed?
So, as I mentioned before, we've basically, and I think most units are doing the same, we've got two separate theatres. So we've got a theatre for COVID patients and for non-COVID patients. So when I say COVID, I mean either symptoms of COVID confirmed or suspected COVID. So that's how those provisions are in place. Please don't think that if you've got symptoms or if you are COVID positive that you're not going to receive the care that you need. We will be providing you care as safely and as quickly as we possibly can.
I think people are worried of the opposite as well, that, am I kind of not going to get, what if something goes wrong? Is there not going to be enough? I think people imagine the hospitals to just be frantic, chaotic, and that you're kind of going to get overlooked. And that there might not be, because there's this specific COVID space now, does it mean that there's less space for routine kind of non-COVID patients to have, if they need an emergency section and things like that?
So absolutely not. We've got lots of space on our labour ward. If we find, we've sectioned it off for now, because we're anticipating that we are going to have more COVID patients. So it's important to have provisions in place if that were to arise. But if you don't have symptoms, don't think that you're not going to be cared for. That there's plenty of rooms on a labour ward. We would do what we would normally do. I don't think that you need to worry too much about that.
Okay, that's reassuring for mums to know. Are women and partners being asked to wear any kind of PPE? And if not, can women choose to wear masks, etc.?
So the only time we're asking women to wear masks are if they have got symptoms of COVID, so suspected or confirmed COVID cases. If they are coming to hospital, then, first of all, they need to call to let us know. And then we're asking them to call us when they're outside the maternity building or block.
Okay.
For our unit, we've got a ramp outside, so we're asking them to call us when they're at the ramp. And then they're met downstairs by a midwife who's in full PPE. And then they'll be given a mask to put on at that point, and then taken up to an isolation room. So they have to keep that mask on for that duration of time. We're not asking all labourers or all women who are coming into hospital to be wearing a mask. I don't really think that there's any reason to be doing that, to be honest. So yeah, if it's going to make feel better and you want to, then no one's going to stop you. But when you're in a fever, I can tell you, having a mask on your face for a number of hours, it's difficult. It's difficult enough for us, and we're obviously not in labour. We're walking around, we're seeing patients, and you feel really sweaty, you feel really hot, you feel like you can't breathe, you feel quite claustrophobic. So I wouldn't think that you'd actually want it on in labour.
Yeah, it's probably start off well, but after a bit it might feel a bit.
Yeah.
My husband was referred to have surgery for a nasal problem that he has. With everything going on, they've postponed it. However, he's got a constant runny nose and sinus issue, which makes others think he is ill till we explain it to them. I'm concerned that he may not be allowed in the hospital at birth, as they may mistake it for COVID-19 symptoms.
So let your midwife know that this is a situation, what's going on, and I don't think it will be a problem, to be honest. And if your midwife needs to contact the hospital to let them know that this may be the case, then they will do so. But there's clearly an alternative diagnosis there. We can't just think that everything's due to COVID.
Yeah.
So I wouldn't think that would be the case, and I wouldn't think you have anything to worry about.
Okay, that's reassuring. And maybe if they've got a letter that shows that
if you've got a letter, even better. I mean, obviously, if you've got those symptoms and then you develop a fever, then that's a different situation. Then then you wouldn't be allowed onto the labour ward, because then you've got something else going on as well with that fever. But yeah, if you've got a letter, even better. Take it in with you, and you can show them.
Okay. Can women have water baths at present?
So for non-COVID patients, they potentially could, because if you don't need the additional monitoring and things, then you potentially could have it. But I think it would vary from unit to unit. I haven't really seen any water baths in my unit recently. So it would depend. I think you just need to check with your own unit to see what they're doing.
Yeah, makes sense. I'm just seeing if there are any others. I think we've managed to cover most of the questions through the talk. I'm just
5 minutes.
There's lots of thank you messages. Honestly, like this talk, I know loads of women were really, really nervous about just being pregnant. I can imagine how stressful it is. I mean, it's stressful enough just being at the moment, let alone, you know, bringing this another little human into this world and not knowing how it's going to unfold. I would say that, you know, things are changing constantly, and hopefully if everybody kind of adheres to what we're being told by the government, you know, things should settle eventually, and hopefully we'll be resuming back to what we're used to in life and with maternity care anyway. But yeah, what would be your kind of final bits of advice to everyone?
Okay, this is your pregnancy. You're only going to be in this situation with this pregnancy here and now. So yeah, everything's going on around you, but still try to enjoy it a little bit where you can. So I know that there's that constant worry. It really sickens me to my stomach to think of what these women are going through. Like, honestly, I can't tell you how much oh God, I'm going to get teary. It genuinely is so upsetting to think that so much is being taken away from these women who should be enjoying their pregnancy. Yeah. But you're in your own little bubble at home. Enjoy it with your partner or with whoever's with you, with your baby. Really connect with your baby as much as you possibly can. Even when you take baby home, okay, in our culture, you have lots of people coming over to see baby, and it can get quite overwhelming. And, you know, you shouldn't be doing that now. It should be when you go home, it should be still the same thing, just you, your baby, and your partner, or whoever lives in your household. So enjoy that time as much as you possibly can. There's lots more questions about Entonox and things like that. On my page, I've done about 3 or 4 posts about COVID-19 in pregnancy, labour, postnatally and breastfeeding. And then I've got a little tab on my highlights with some updates, because over the course of the past few weeks, there have been various updates from the Royal College. So I've tried to put those there. So if we haven't answered your questions, please just take a look there, because hopefully I would have answered your question in those bits. Yeah,
they're really helpful, those updates. I'm always sending them to friends and things that are pregnant. But thank you so much, Pavan. Please keep yourself safe. Thank you for everything that you're doing, for keeping mum safe. And I hope that, you know, if you are redeployed, it goes well. And I just want this time, like everybody else, to just pass, and everyone to pass through it safely. But thank you so much for your time. I know it's precious, especially when you've got a day off with the family. So thank you so, so much.
Thank you, and thanks for everyone's questions. I really enjoyed it. Actually, it's been quite therapeutic just to get lots of information in my chest. Hopefully I'll have a good night's sleep tonight, because I haven't in a while. But yeah.
So maybe we can catch up in a month or so, when things might be a bit different, to provide people with an update and just keep them kind of reassured that despite the situation, you are being taken care of and everything will be okay.
Yeah, absolutely. Yeah.
Take care, Pavan.
Okay then, Harps.
I'll speak to you later. Bye. Bye, guys. Take care.